Hello, residents of Freedom Village. This is John Bruner, your Executive Director, and we have our special guest today, Dr. Andrew Ulichney. He's our Medical Director and has been an amazing partner for us throughout this COVID-19 pandemic, and we're so appreciative to have him and his guidance. He's been an integral member of our task force, and as a matter of fact, just today we met with our task force to talk about how we're progressing, talking about our testing strategy, to discuss a little bit just where we are in the pandemic and what we're seeing in the hospitals, as well as getting his thoughts on our phased reopening plans. Dr. Ulichney is here today to talk with us a little bit, and the first question I have, Dr. Ulichney, is 3 months in to this pandemic, what's your overall perspective on what it's done to the senior housing and long-term care industry, and what's it look like over these 3 months, and what's it going to look like in the future?
So I'm happy to report that we seem to be on the downside of our peak. Mainline Health and the state of Pennsylvania, we've seen day-to-day numbers decreasing. Unfortunately, it's not zero. Unfortunately, far too many people have been affected, including in our community. In terms of senior housing, this virus definitely has a propensity to find infirm folks of any age, but specifically people that are in congregate settings, your nursing homes, your personal care homes, your dementia units, your adult with learning disability facilities. Those have been the major targets in our area and in our Commonwealth. So I think it's exposed the fact that folks in those settings are, one, vulnerable. They were vulnerable because and infirm to get to those states, and when it gets in there, they have very little defense to stop it. I've had many patients north of 90 recover from COVID-19, I'm happy to say, and the unifying factor has been mobility. People who are in a bed and a chair the majority of their time do the worst.
Mm. So I've seen some interesting statistics as far as the deaths in not only Pennsylvania but Chester County. They seem to be very, very high in long-term care facilities. In other words, the number of deaths of younger, healthier people is very low, or even people in a independent living setting like this.
Correct. So the independent living activity, mobility is critically important. And so yes, it has disproportionately hit that segment of the population, and many of the people in those settings happen to be older than 80.
I guess the lesson with that is keep moving, right?
Absolutely.
Keep moving.
Critically important. And that's what we talked about in our opening strategy session, is trying to find activities to promote wellness, to promote strength and endurance training, to promote activity. So there's limited guidance from both the federal government and the state government on how to do this. So I think LCS and Freedom Village and John and his team are making a very conscientious, thoughtful approach to opening Freedom Village back up. We don't want to go too far too fast. We are bound by the governor. Some governors have made it very crystal clear, like in New York, every employee in long-term care had to be tested. While it was a recommendation in the Commonwealth of Pennsylvania, it was not mandated. So we're somewhat limited in what we can require people to do in the Commonwealth of Pennsylvania, as opposed to New York, which had a very strong central hand in telling facilities and personnel what they had to do.
Good point. I mean, we've rolled out universal testing in our health center, but without the backing of a law that requires it. People still have personal freedoms to choose whether they want to be tested or not. I think we've done fairly well, considering we don't have that law behind us, but there's still associates do have the right to choose whether to be tested or not to be tested.
And the Department of Health put the onus on facilities like nursing facilities but said nothing about testing people in the hospital. And I will tell you the hospital systems in the area only tested symptomatic employees.
So I guess back to the reopening. So May 22nd, Governor Wolf announced in a news conference that the southeastern portion of this state, like Chester County specifically, will be going to the yellow phase. So that's promising for the resumption of normal life, but it's not necessarily the same at Freedom Village. So, but in conjunction with that, LCS is doing a phased reopening plan. And as Dr. Ulichney mentioned a moment ago, they are specifically looking at some of those physical activities and specifically outdoor activities that we can start to open up the community. And when I say open up, I mean internal activities. We're going to much more slowly and cautiously open it up to bringing external activities into the community because we want to mitigate that risk of bringing the virus in, but obviously encourage physical activities to increase wellness, to decrease the risk of depression and other diseases that occur from the isolation which so many people are experiencing. Yes,
and Mainline Health is opening for business. We're currently at 30% of our capacity. That's going up to 50% after June 1st. So elective procedures, colonoscopies, mammograms, labs, all that is available now. So I would not defer health maintenance any longer. And I will tell you the systems are going above and beyond and really trying to orchestrate ways to keep the patient safe, their staff safe, to decrease the risk of transmission.
So the hospital's opening up. Is your office already also opening up and starting to see patients?
Yep. So we're in our second week of about 30% capacity. We have one-way traffic flow. There's no waiting room in my office. People wait in their car for a telephone call. The front staff is separated with a partition from patients. The patient only interacts with my medical assistant or nurse and myself, and we bring in anything that's needed, such as the after-visit summary, prescriptions, x-ray requests, lab requests, and then they leave from a separate door. So there's a very thoughtful approach that many providers are putting forth, and the rooms are cleaned in between each patient. They're out of use for 30 minutes. So they and both sides of the patients and all of my staff, we're still wearing universal masks. We don't have masks on right now to facilitate communication. We're also probably slightly less than 6 feet apart, but that's so that we could be in the same camera angle. And I know our CEO, Jack Lynch, he does his town hall meetings in a very similar format, and he has the same limitations that we are encountering with technology.
Right. So, as I mentioned earlier, we're about 3 months into this pandemic. From everything I read, even in the best case scenario, we're months and months and months away from a vaccine. You know, what do the next 3 months, in your mind, look like at a facility like Freedom Village?
So I have encouraged, and I'm optimistic. I've always had an optimistic outlook, and I do think things are going to get better. I have a bit of concern for the fall and when weather changes, but I think coronaviruses in general don't do well with heat and humidity. I think people being out and not confined to areas will also work to our favor to decrease the risk of transmission. In terms of the fall, we're expecting a low level of disease throughout the summer. We do not think it's going to go to zero, but we think it's going to be significantly less than it was. About the second week of April was our peak at Mainline Health. And we are maintaining a lot of the strategies should we see an uptick in activity, that we decrease some of the elective procedures, and we also have the infrastructure to increase our capacity in the hospital. We had about 6 levels of care capacity at Mainline Health. We only got to the second tier which was essentially regular operations enhanced with some of the beds turned into critical care beds. But we were able to weather the storm. I know Chester County, I know Tower did well, but we're anxious to get back to doing what we have done previously.
It's quite amazing how the narrative has changed with this, because remember, we all know the initial idea with the lockdowns was to flatten the curve and not overwhelm the hospital systems, and that never really happened in the Philadelphia area or pretty much anywhere except for temporarily in New York City.
Correct. The Metro New York area definitely was ground zero, and they faced the biggest numbers. Philadelphia, we were very lucky with our capacity and the diligence of the folks in the area to mitigate the risk starting in March and definitely in April. And now we're starting to see the benefit of it with decreasing numbers and hopefully more activity allowed through Governor Wolf relaxing some of the restrictions.
Well, I think that's what we'll kind of wrap it up, that slowly we will start to relax some of our restrictions at Freedom Village, but it's a balance between the benefits versus the risk, and there's many benefits that we know that we're missing out on by being as restricted as we are, and we're going to do this carefully. We're going to do it with your guidance. We're going to follow guidance of all the health department officials, the CDC, Life Care Services, and as we make these decisions, we'll share them with you. But we got a great team, including yourself, Dr. Ulichney.
I'm
really
happy
appreciate
to be part of the team. Trust me, I'm very happy to be part of the team. And also, some things are mandated. CMS right now is very strict about the Center for Medicare and Medicaid. They are not wavering on their keeping skilled facilities very tightly controlled, and that will only change from Washington.
And that's a great point, Dr. Ulichney, because we believe we're going to be able to look at our campus as segments. As you've heard me say in many announcements, we haven't had a positive case here since April 10th. And as of the date of this filming, we're at May 27th, so we're pushing 2 months almost. We could look at independent living truly as a different portion of the campus, relaxing some of these things. Our more regulated areas, like our health center and specifically CMS, which regulates our nursing home, they're the most vulnerable folks, the least mobile folks in nursing care, and we will not be making the relaxed restrictions in the skilled nursing home at this point.
Yeah, we're mandated that we can't.
All right. Well, thank you, Dr. Ulichney. I appreciate you coming on today.
Hopefully 3 months from now, it's an even better report.
Well, I look forward to you coming back.
Absolutely, anytime.
Thank you, everyone.
Thanks.